I will go ahead and get started and just welcome you all to our community. As most of you know, and for those I don't know and have the privilege to meet just yet, my name is Joanna Deshay. I have the great pleasure of serving as Executive Director of Diversity Leadership Alliance. And this is our 2025 webinar series on agency, equity, and social justice. And as we said before, the words may change, but the work continues. After about 23 years of driving progress around DEI, taking actionable steps, and having these critical conversations, we are navigating through 2025 with resilience, especially community resilience, and renewed hope for open minds and open hearts around agency, cultural humility, and belonging. There's still so much work to be done. And in today's climate, we find ourselves battling, right? So that racial battle fatigue is real for a lot of us in the community. But steadfast is a great word that I saw. So remain steadfast and continue the work. I am so grateful to have the opportunity to share this dynamic panel with you. And as they were even saying, such a timely conversation. So all we ask is that you be open to receive and that you also share. We've got a couple of places for you to do that in the Q&A area, and also feel free to share in the chat. Before we begin, I want to bring in, and he's on with us already, our amazing founder and leader, Mr. Marion Kelly, who will kick us off this morning with sharing a few words and a few thoughts. Marion, good morning to you and welcome.
Thank you, Joanna, and good morning to you. Good morning to the panel. Thank you for stepping up, particularly at this time, because I think it's important that we be that map for those who have lost their way, that we be the map for those who don't know which direction to go, that we continue for the next 25 years as the guidepost for those who are wondering which way is up. So I asked Joanna if I could come on just for a few minutes before the workshop started last week, because I want to give a perspective. And it is just that. I don't want you to think that these are all the answers, or this is the only way, or the correct way, and all others are wrong, because that is not what I'm doing. What I'd like to do is give you a 67-year-old African-American man who has lived through some things in this life, who has worked in corporate America, who has worked on Capitol Hill, who has worked in the White House, who has worked at schools of medicine, who has been a consultant, who's done a number of things that I think experience is the best teacher. And so let me start with, we've been here before. This is not new. This is a temporary place that we find ourselves. And when we find ourselves in temporary places, not knowing which way to go, we have to look inwardly. The answers are not always obvious to us. I have said this before, I think in this group has probably been several years. I come from a very large family. I have 6 brothers and twin sisters. And my father always said, the answers to all of our questions are in our house, in our yard, or in our midst. And everyone that is at this table this morning is in one of those places. You're either family, and so you're going to communicate with one another. You're in the yard, that means you've been invited, and you're over to play kickball or basketball or whatever it is that you played as a child. Or you're in our midst. You're in our community. You're working in city government. You are a consultant trying to raise the level of understanding. You are in a place where you can influence and help influence others. So I start with that. This is not the first time that we have been kicked in the gut. This is not the first time the airs have been deflated from our tires. But those of us who sit in these spaces, who do this work for a living, we also need to refresh. And we also need to look to others within our house, within our yard, within our midst for those answers because we have them. They're all right here. But sometimes we have to look to someone who's in that space to get your juice flowing again. So I always try to go to resources when I find myself in a place where I'm not sure to go, where to go. And I have gone to one of my favorite authors. And you all, I know that you know him, whether you have known him for 50 years or 2 years. Um, I think it's probably the best book in the world, and you all need to get it because there's great understanding and wisdom that comes here. My favorite author is Dr. Seuss. And Dr. Seuss, 2 years before he died, wrote a book called Oh, the Places You Will Go. Now, I used to use this book with my children when they were young, and now use it with my grandchildren who are 5 to 16 years old. And so Dr. Seuss wrote this book really for a graduating class of folks that got their PhDs. These were experts who were about to do an onslaught on the world. And oh my God, when you first get your PhD, particularly if you get it right after undergrad, graduate school, and then PhD, before you had lots of experiences, you think you're going to own the world, rule the world, and teach the world. And you are. But there are some places you will go that you have to understand that it's part of the journey. And so I have highlighted a few areas that I think are important for us to understand. So this is after graduation with your PhD, which all of you have. You'll be on your way up. You'll be seeing great sights. You'll join the high flyers who soar to great heights. I'm sorry to say, sadly, it's true that bang ups and hang ups can happen to you. You can get all hung up in a prickly perch, and your gang will fly on. You'll be in a lurch. And I'm skipping pages. You all need to get the book. And when you're in a slump, you're not in for much fun. Unslumping yourself is not easily done. Unslumping yourself is not easily done. You will come to a place where the streets are not marked. Some windows are lighted, but mostly they're dark. A place you could sprain both your elbow and chin. Do you dare to stay out? Do you dare to go in? How much can you lose? How much can you win? And if you go in, should you turn left or right? Or right and three quarters? Or maybe not quite? Or go around back and sneak from behind? Simply, it's not, I'm afraid you will find, for a mind maker upper to make up his mind. For people just waiting. This is called the waiting place. And that's where we are right now because while we've been here before, it looks a little different. It's the same game, just a different face. And so when we see DEI being attacked, it's not our job to fight, it's our job to light a candle. So instead of cursing the darkness, light a candle so that you can make sure you are bringing positivity, you're bringing light to a dark situation. Waiting for a train to go, or a bus to come, or a plane to go, or a mail to come, or the rain to go, or a phone to ring, or the snow to snow, or waiting around for a yes or no, or waiting for their hair to grow. Yes, that's me. Everyone is waiting. Waiting for the fish to bite, or waiting for the wind to fly a kite, or waiting around for Friday night, or waiting perhaps for their Uncle Jake, or a pot to boil, or a better break, or a string of pearls, or a pair of pants, or a wig with curls, or another chance. Everyone is waiting. But what I would suggest to you is that while you're waiting, occupy the territory. Think about the things that you've been through, the things your ancestors have been through. Our ancestors are probably looking at us thinking, oh my God, they have it so easy compared to what we went through, compared to the fights that we had to fight. We can't see their perspective, but that's because they had it so much harder. It's our job as diversity practitioners. It's our job as people who work in DEI spaces. It's our job who, if you're an employee who just happens to support DEI initiatives, it's our jobs as women, as LGBTQ community, as minority populations, to make sure that we're always reaching forward and reaching back to bring those with us. And I don't mean that from a affirmative action place. I mean that from finding those diamonds in the rough and shining them and buffing them and getting them ready for the next place in life. And so if you occupy this time that we are wondering which way to go next, and you keep doing differently what you've been doing all along, style makes all the difference. And so there are some words that we may not be able to use as freely as we've used them in the past. We need to learn some new nomenclature. We need to be more inclusive than we've been already and use words, phrases, verbiage that is going to be heard and not those words that we know will get us in trouble. It's so important that we learn to pivot, because if we don't learn to pivot, we will not be successful in getting our organizations, our communities of faith, community-based organizations to where they need to be. So let's not think of the population that we're serving. Think about the mission that we have. So if your mission is in housing, that's what your focus is. It's not the population that gets the housing, because that population will get the housing if you stay focused on your mission. Learn to use the calling that you have to fulfill a need that is unmet in this community. As long as you are showing that you are bringing to a community a rising tide that lifts all boats, that will be accepted. Now, many of us work for organizations who have been leading in this space. Many of us, unfortunately, work for organizations who have decided not to continue it. They've closed DEI offices. Because an office is closed does not mean the work stops. The work continues from your desk differently. And so if your organization is not going to lead, but they still support the work, then do the work in that style. Do the work that continues to move us forward, so that when we get through this temporary period, we've not regressed and having to make up for that lost 3 years. It's only 3 years left in this administration, and things will change in the next administration. So let's work from where we sit. Let's continue to do this work. Let's continue to look to one another in order to strengthen our tool chest, to take each of us forward. And perhaps the next workshop is a workshop that we do internally with everyone that's on the workshop, because we have all the answers. We bring experts to share their perspective and their expertise and what's worked for them. But we have people who are in the trenches who have different experience. We may be able to write a book, how to get unstuck, how to get yourself unslumped, experiences from the teachers to get us to that next place. I am so honored to be here today. I can't stay the entire time because I have an appointment at 10:30 on another campus. And so I'm going to stay on here as long as I can. I have my trusted colleague, Erick Garcia, on here. I know he's going to be a part of this panel and be a great contributor. Thank you all. It's been my honor to found this organization along with my co-founder, Christine French. We've been doing this for longer than the number that we put on our annual conference because we did this 3 years prior to becoming a 501c3. We're going to be needed for the next 25 years as well. We're not working ourselves out of well, none of us get paid, but we're not working ourselves out of a job. Have a great workshop. Have a great day. Thank you, everyone, for being here. This is the most critical workshop for the time that we're in. Blessed days to you.
Thank you, Marion. We are so grateful for your leadership. And you should see the comments. You have folks who are like, I have this on my bookshelf. We've got a couple of educators saying this is a great way to kind of teach kids about this time that we're in. So I just love the comments. Keep them coming. Lots of thanks to you, Marion. As you all know, we are designed as an organization to bring voice to marginalized communities. We want to provide a forum for constructive dialogue. We want to help eradicate racism through strategic professional development workshops such as this one. Together, we believe that as a business and community, together we're going to enhance the workplace and highlight the value of diversity as an essential part of successful business models. We want to cultivate change, and we are ready to do so with a renewed sense of bravery, a renewed sense of urgency, and most importantly, a lot of empathy and a lot of kindness through these vital workshops that we do here and our annual conference and youth leadership program. We intend to provide a safe space and place for you to have these critical conversations that impart change. So I want to just do a quick land acknowledgement and move to introduce you our panel members that you see here so they can get to the meat of it all and get your questions answered and also answer a few questions themselves. We recognize that we are simply stewards of this great land that we occupy. We would like to acknowledge and identify the indigenous people, nations, and histories within our area, and we're here in Phoenix, Arizona. We would like to acknowledge the Akimal O'odham, the Peeposh, and the Yavapai people. We acknowledge them as a people, their ancestors, their descendants, and this, the land itself. At DLA, we're always working, right? We're trying to progress through just land acknowledgement into more actionable items where we can build actual solidarity through an action plan with our Indigenous community. So as we look at today's workshop, it is all about being in community. This webinar series explores what a unified community looks and acts like. Today's workshop, The Oneness of Community, is a strategic roundtable with industry experts that you see here that are going to talk about actionable items that you can take in this changing climate. Before we do, I just want to remind everyone, you know our community rules of engagement. This is a respectful place. We want you to foster greater empathy with each other. We want you to listen actively. Definitely ask questions for clarification, but please be respectful to each other, to our presenters and our panelists. And I just hope no one kind of dominates the discussion in the chat area. But most importantly, and this is a simple one, if we would do more of this, is be kind and show love and respect to each other. Okay, so let's go ahead and get started. In today's workshop, we are going to reunite to rethink and refresh our approaches to building stronger and more connected communities. So I'm going to actually, Marion, if you don't mind, I'm going to just go ahead and have you take your camera off if you don't mind. Excellent, thank you. Stronger communities. So through today's panel discussion, our industry experts will share with you insights on cultivating partnerships and seamlessly reimagining strategies to integrate diverse perspectives into organizational cultures and environments. So we ask you to get your questions ready. We ask you to get your comments ready, to make them here and to ask the questions in the Q&A area. So I'm going to just tell you a little bit, and I'm telling you, when I tell you I'm reading their brief bio, that's because these individuals that you see here are phenomenal, and we will be here all day just reading their bios because that's how much they do in our respective communities. So the first person I want to introduce you to is Kamana, and she is the manager in diversity, equity, and inclusion lead for Cable One. And she is a dynamic DEI leader with over 14 years of experience driving workforce transformation. As manager of DEI at Cable One Sparklight, she leads enterprise-wide initiatives, leveraging data and cross-functional collaboration to embed equity and belonging into their corporate culture. She serves on several boards, and if you look on the website, you can kind of see their full bio there. And her industry impact earned her the 2024 Advocate for DEI Award. She has a master's in public health and an advanced DEI professional certification from Cornell University. She is committed to shaping the future of workplace inclusion, whether that's driving strategic initiatives, speaking on industry panels, thank you for joining ours today, or mentoring emerging leaders. She is a champion for equity and innovation. Good morning to you, Kamana. So thank you so much for being here. All right, let's keep going down the line. He is no stranger, and he, along with Tondra Richardson, serve as our co-chairs for the Education Committee, responsible for putting on these monthly webinars that you see here. And that is Erick Garcia. He is the Enterprise Equity, Inclusion, and Diversity Advisor at Mayo Clinic, Arizona. He is a dynamic leader specializing in healthcare administration, human resources, equity, inclusion, and diversity. Has over 10 years of experience in large multi-state organization and has successfully advanced inclusive cultures, addressed health disparities, and built sustainable equity programs. Since joining Mayo Clinic in 2021, Erick has served as the Enterprise EID Advisor for the Arizona and Florida sites, supporting leadership, physicians, scientists, nurses, and allied health staff. Erick holds a bachelor's degree in kinesiology from Arizona State University and a master's in healthcare administration from Grand Canyon University. A proud father and husband to an emergency department nurse, he is a courageous servant leader who challenges the status quo to inspire change. Good morning to you, Erick. And last but most certainly not least, is Dr. Nika White, President and CEO of Nika White Consulting, who I'm a kind of a fangirl, so you're gonna have to apologize for the fangirl moments I have throughout this. Dr. Nika White helps maximize people's and organizations' effectiveness, potential, and capacity. Her overall practice and scholarship are in organizational development, specifically focusing on systemically operationalizing strategic and intentional efforts that foster diversity, equity, inclusion, and belonging, as we know it to be DEIB. Her work has led her to designation by Forbes as top 10 D&I trailblazer. With over 20 plus years of leadership, she has worked with hundreds of organizations and managed millions in business assets for clients. Dr. White's latest release, Inclusion Uncomplicated, we'll have to put that in the chat so folks can get that as a way to build their repertoire of information on their bookshelves. A lead principal consultant of Nika White Consulting is a full-service boutique DEIB consulting firm. And Dr. White leads a whole team with the mission of making DEI practical so that organizations can shift systems to cultivate a culture of belonging and go to the next level. Yes, we are taking it to the next level on their DEI journey. Good morning, good morning, good morning to all of you. So, thank you so much. I want to make sure you all unmute yourselves and we get ready. We're going to take this conversation in what I call 3 stages. And we've all kind of talked about what do we want to talk about? Because there's so much to talk about, right? And the one thing we want to realize is that what will not be, and we said this earlier when we were chatting, is we will not be fearful. We will not sit in a place where we are stuck and paralyzed, we'll call it that, by fear. So as we begin the conversation, I would love to know, what do you think, as we think about the space that we're in now, what do you think organizations can do from a cultivating partnerships and fostering diverse perspectives? So that's the lens I want you to look at. What are the most effective ways that you think organizations can move beyond what we've been seeing with this performative allyship, right? So we can build meaningful long term partnerships. Because the one thing we've been seeing, I'll use this as an example Target. There was a lot of performance there, right? And then the minute that they didn't quote unquote have to, they removed those efforts. So we'll start, Kamana, with you. What do you think organizations can do now, right, to have a more effective approach as we look at cultivating partnerships and fostering diversity?
I think one shift I've seen that really separates like true partnership from what you're calling like performative allyship, right? Is the move from sponsorship, we've been hearing that a lot, sponsorship, to maybe co-creation. So instead of organizations helping underrepresented groups, they should, I think, invite them to design, invite them to shape and lead initiatives. I think that's where the magic happens when DEI isn't a charity effort, but a shared power model. So, for instance, there are like some companies, Johnson and Johnson, Accenture, Microsoft, Apple, a lot of them are actually restructuring their supplier diversity efforts. And it's not just pledging to spend more dollars with diverse business, but really investing in their capacity, building them, offering mentorship and co-developing solutions. So this isn't just about writing a check now, right? It's about really that shared growth. So I think that's where we are right now.
Dr. White, what about you when we talk about this kind of performative allyship, right? What do we do to move beyond that and build more meaningful long-term partnerships, ones that can actually amplify diversity?
Yeah, thank you. Good morning to everyone. And let me just first start by expressing my gratitude and appreciation for being a part of this esteemed panel. So thank you, Joanna, for the invitation. And I certainly enjoyed hearing from founder Mary and Kelly at the beginning of our time together today. I agree with Kamana that I think that part of how we need to approach this very specific time that we're finding ourselves in as we're navigating the terrains of all the changes that are coming forth is to first remind ourselves and our organizational leaders of what is the difference between performative allyship and really truly being committed to the work. And so I'm going to approach this question from talking about it very explicitly in context of what we're experiencing right now. The first is that the business case matters more now than ever to all organizations that are aligning themselves with the essence of diversity, equity, and inclusion. Not that it hasn't been important before, but now we are finding that in this capitalistic state that we are in, people are really paying close attention to how the work of diversity, equity, and inclusion is benefiting the bottom line. And I think that that also speaks to the performative nature in which some organizations could be executing this work. It's not really moving the needle. So, how are we being meaningful around our practices to move the needle? The thing is, I think about being able to strategically identify what are those actions and those strategies that right now at this juncture matters the most in terms of organizations touting and communicating and socializing its value set and commitment to DEI. This is not the time to be silent. I find that when performative habits show up, it's typically because people are not leaning into this with specificity around how in which they are practicing the work of DEI, not just that they're doing it, but how in which they're trying to maintain it in a way that's very impactful. It is certainly the same game, but there's different rules now, as Marian mentioned at the top of the hour, which I appreciated that. I'm also sharing that I think some people are finding a lot of value in practicing what I am referring to as strategic patience right now as we navigate the rapid changes. It's important to respond and not react. I am seeing some knee-jerk reactions that are appearing very performative because they haven't really fully set with all of the intel to understand how do we need and want to show up in this moment. So that's another thing that I am really spending a lot of time educating some of my clients around. And I think it's important to realize that how we choose to act right now is much more important than the actions themselves. The how is more important than the what. And that's why I tend to say that strategic patience is really critical. I also believe that as we solve for the margins, and if we're addressing the needs of the margins, we are uplifting everyone, and we have to tell that story because there are a lot of people right now that perceive that this work is only for certain individuals and populations. And so the stories we tell, they really are shaping our collective worldview. And I think those stories, because they're so authentic, it helps us to maintain a level of accuracy and a level of trying to stay out of the path, right, of being performative, because our stories are our stories, right? There's a lot of truth that's held in our stories. And then I'll say that hope is definitely a discipline worth cultivating. Joanna, when you asked the question at the beginning, how are we showing up to the conversation? I placed the word hope into the chat because I have recognized that hope is certainly a discipline that we have to cultivate during this time as champions and advocates of this work, because our priority must be to sustain impactful work. And that is evidence of organizations that are not operating from a place of performative, but really deeply committed in action so that the outcomes are realized. We're in a crisis moment right now, and this is where innovation, creativity, ingenuity really shows forth. And so let's rise to the occasion, as it has already been stated. What has taken place to get us to where we are right now has been years of masterful planning and strategic foresight. And I am using language like honestly impressive, not because I like what's happening, but because the mindset, all of the rigor that has gone into getting the plan in place that's now being carried out, it really is impressive. Impressive from the standpoint of there is something for us to learn in this moment. And so as I think about just rounding out my commentary here, community is at the center of that. And part of that community means let's get out of our own way, and let's really deepen our empathy and our compassion and our care and concern for humanity. Let's find our people. Let's make impact where we can. And let's not forget to take care of self during this process, because we have to lean into those moments of joy. Joy is a form of resistance. And I believe that collectively, all those things together is really going to help us stay out of the camp of performative work in this space of DEI and more into the work that is meaningful and impactful and really changing lives.
Ooh, I took so many notes. You have to see, I'm trying to, I need to learn shorthand. That was amazing. Thank you all for that. Erick, I want to bring you in now and just talk about that. So we heard Dr. White talk about this idea of strategic patience, right? The idea of responding and not reacting. I love that, by the way. So when you think about the seat that you sit in and the work that you do there, can you kind of share what does that allyship look like from the Mayo Clinic perspective, or just from the corporate perspective as we move into this new climate?
Yeah, well, first, I just want to start off by saying thank you for having me here. I'm excited to share my thoughts, but also hear the thoughts of my colleagues on this call. And of course, Joanna, amazing as always. But as I kind of move into this question, so you'll probably hear me approach this conversation very differently as I have in the past, given our current landscape. And I say that to preface that I have thought a lot about what our landscape looks like, what organizations have to look like, and how work will maybe shift, how work will change, but it might look different, it might sound different, but it might remain the same. So with that being said, I would say within this place, I would typically lean on data and metrics to drive this, as if I was to talk about that in the past. But as of right now, I would say as if I'm looking at this question from this different standpoint, I would really want an organization to center themselves on the impact over intent. So rather than focusing on good intentions, organizations really should be measuring their effectiveness based on the impact of their actions on marginalized and underrepresented groups. So what does it look like? What does it sound like? What does it feel like for those individuals who might be underrepresented or feel like they don't belong in the organization or their levels of inclusion are very low? So I view it from that standpoint, and I'm very fortunate at the organization I work at where, yes, we are data driven, everything is backed by metrics and so on, but oftentimes our leadership teams look at what is the impact of the work that we're doing and how are we reaching our communities and what is the outcome of that? Are we seeing any movement in that space? Are we seeing people feeling better? Are we seeing people just ultimately being healthier individuals? So I would say approaching it from that lens with not just focusing on good intentions, because we all know when we all come from different places and different spaces, and our intentions are very much different. And oftentimes it leaves us in the space where we're able to make assumptions about others because we have good intentions, but it's really focusing on what the true impact is and being able to tell those stories.
And Erick, well, we'll stay on you for just a second, and then we'll go back to Kamana. But as you think about it, for all of you, and you think about it from a leadership perspective, your job is to inform leadership about the direction of DEI, especially because I know you work closely with your ERGs and the programming that your ERGs do, both at both sites. And I just wanted to know how are you informing leadership? What are the words? What are the strategies that you're kind of sharing with them for how to move forward, right, in this new climate? I wonder if you could just share a little light on that.
Yeah, it's really being able to share the previous experiences. So as of last year, our employee resource group, specifically speaking for Arizona, we had over 100 events totaling thousands and thousands of staff members participating in these events. They were internal and also external, so kind of for our workforce facing staff members as well as our community facing and our patients, but over 100 different events within that space. So as we fast forward to our current state now, showing that information, showing that data that says we've done this in the past, there's so much support for this, and there's the excitement, and as I mentioned, the impact around this. Why would we change it? We understand we might, like I said, it might have to look different, it might have to sound different, but why would we change the approach that we're taking when it's been so positive and staff have seen it as something that creates engagement for them? We've seen their levels of retention increase where they're staying with the organization longer and also feeling better about their work and being more engaged and excited about it. So being able to approach it from that lens, I think, is critical, and showing where you've been. And just because someone says it needs to change or it might need to look different doesn't mean it needs to fully change. It just needs to evolve and adapt a little bit.
Okay, thank you so much for that. So, Kamana, we've seen DEI be weaponized, right? We've seen the word be weaponized throughout, the nation, really, and a lot of people are reacting to that. So, when you think about it from a leadership perspective, how can leaders ensure that DEI is not this separate initiative, right? That it's fully integrated into part of the organization's culture, maybe even at your culture there at Cable One. So, what are you all doing? What are you saying? What are the business strategies that you're sharing with your leadership for, as Dr. White so eloquently said, to respond but not react?
Yeah, so you kind of answered that right there, right? So the key to ensuring DEI isn't just a side initiative, but it's like fully integrated into an organization culture, is to stop treating it as something extra, because that's what we always do. We treat it as something extra, something like an add-on, and we really need to start embedding it into the everyday rhythm of be it decision making, leadership, your operations. It needs to be embedded. There are three shifts that I can think of that, I mean, we're also implementing in at Cable One, but the three shifts that can make this really happen is embed DEI into everyday leadership and not just training, right? Because we have been focusing on training so much, right? Those unconscious bias training where every organization starts there and ends there, right? So as we all know, leaders set the tone for what gets prioritized. And DEI should be a leadership competency and not just a value statement. So instead of asking leaders to support DEI, tie inclusion to their core responsibilities. So look at who they mentor, look at whose ideas they're amplifying, and look at how they are making decisions, how these leaders are making decisions, right? So ask leaders to check in their meetings, right? Who is speaking at your meeting? Who is speaking the most? Who is at that table? Who gets interrupted the most, right? Small shifts like this in like everyday actions, like everyday meetings, as you think about like how they run, those can create like big cultural changes. My number two is make inclusion a business lens and not just an HR initiative. Because where does DEI lie? HR. Will HR ever focus on DEI? No, we have lots of competing priorities, right? So if DEI only lives in HR, it's always going to feel like an initiative, right? So instead of using DEI as a decision-making filter across business functions, you have to think about it, right? Hiring, promotions, customer engagement, innovation. Think about DEI. Think about all those things from a DEI lens. So my challenge to the DEI practitioners in this room is to really lead with innovation, risk reduction, and growth lens instead of what we've been doing in the past, which is we've been leading from an equity and representation lens, right? So instead of you saying diverse teams drive inclusion, saying that plainly, what you need to now say is diverse team drive 35% higher financial performance. So then you're really connecting it to the business. So instead of saying psychological safety matters, say high trust teams have 50% higher productivity and retention. My last point here is shift from DEI as a goal to DEI as a process. So because DEI is not a one-time achievement, it's an ongoing practice, right? Organizations have to commit to it. It's not you hire that one DEI person full-time and you're like, yay, they're going to change everything. It's not going to happen like that. It's a process. So organizations that do this well, they treat inclusion like innovation. So they're constantly refining, they're constantly learning, and they're constantly improving. So you can create like one small change. Don't just think about like these big things you're going to move the needle on, make this big, change the world, change the organization. Think something small, like small shifts. Maybe rotate your meeting. Who leads the meeting? Rotate that. Diversify recruitment sources, or even ensure all voices are heard in like your brainstorming session, your decision making session, right? So I'm just going to push you to do like small but consistent action that's really going to create this lasting cultural change. Because right now, I don't think our goal right now should be make DEI loud. I think we should really make it like second nature. That should be where the DEI practitioners should be pushing it. The most inclusive companies, they don't just do DEI, they lead and operate inclusively by design. And that's how we need to think, I think.
Oh, that's beautiful. Man, people are going, wow, 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 just so you know, in the chat. So I see that a lot. So that is so powerful. So I want to shift now just a little bit. Thank you so much for that. To looking at the idea of resilience and sustaining the momentum, right? So, Dr. White, as we think about all of the things that Kamana just shared in terms of the shifts, right? Embedding it into leadership, looking at it through a business lens, shifting from DEI as a process, and as we look at that in the refinement of it, in the face of what we're seeing now, the resistance or pushback against DEI efforts, what are some of the strategies that individuals and organizations can use to maintain resilience? We talked about that community resilience and continue to make progress, because we're hearing a lot of people are stumbling, right? They're losing momentum. So what can we do here?
Yeah. I love this question. It's so important, and it's a conversation that I have been having a lot lately, of course, as you can imagine. I think the first thing is we need to be willing to talk about it. We need to find that level of courage to acknowledge what's happening and to be in dialogue. So I am a big fan of pulling employees together, whether it's small groups or by department, whatever the case may be, and just giving those individuals a time to process and community around what they're seeing, what they're hearing, what their concerns are, how they think it's impacting maybe how they're showing up to the workplace, and even the precise implications they anticipate for the organizations of which they are a part of. And leaders need to be willing to hold those conversations. And so upskilling our leaders to hold those conversations is really critical. critical. It's not to say that you're going to have the answers in those conversations, but it's also acknowledging that you are keenly aware of how what's happening outside of the four walls of the organizations may be impacting productivity and people's, mental strength. And I think that's critically important because it shows care and concern on behalf of the leaders and the organization. I think the other thing that I have been seeing a lot of lately, and even encouraging, is what I've been referring to as these strategic reset conversations. And that is nothing more than pulling together all of your key stakeholders, your key senior leader stakeholders, and being in conversations, strategic conversations around what do you see the risk, the vulnerabilities, the implications being to the organization, and then letting that serve as a starting point for engaging around alignment topics of how do we want to show up in this moment. I am keenly aware of so many situations where organizations have set out to do the work of DEI, and they did so because at the leadership level, they had consensus around we believe in DEI. We're going to value DEI in terms of how we show up to the world. But then when we start to really break that down into very specific behavioral, practices or organizational systemic kind of shifts, there's misalignment. And so what I'm finding is that people have different perspectives about what that looks like to be doing the work of DEI effectively. And it's not always, really aligned. And so I think those conversations are really important now because of all the shifts that are occurring. And don't just bring in your legal folks. I think that the legal and compliance individuals and professionals are really, really important to this conversation. But what I'm finding is that the hat that oftentimes those professionals wear, it's about mitigating all of the risk, trying to eliminate it. And this calls for us to not be afraid of some of the risk, right? But to have those hard conversations and really think about how we want to show up in this moment and in consideration of all the implications that the organization could be faced with. And at the individual level, because all of those ideas were more about the organizational level, I would say that we need to find ways in which we are thinking about where do we have the biggest level of impact, right? What sphere of influence do we reside in where we know that we have some impact? And to don't think that those efforts are too small. I love that Kamana talked about the importance of finding just consistency maybe in the small acts. And I think that that is critically important. We may not be able to boil the ocean. In fact, we can and we shouldn't even try. That's going to make us feel defeated even before taking the first step. But with those that we have influence and relationships with, we can be of support. And so let's focus there and let that fuel us to maybe some greater, more loftier goals while, again, we are trying to navigate the complexity of this current state and time that we find ourselves in. You are mute, Joanne.
I know. So here's the thing that is so powerful and so timely, because we were even in December when we were meeting as an organization, there was some talks. Folks asked us point blank, "Are you going to change your name?" And I said,
Yeah.
they're like, well, diversity leadership alliance. It's like, yeah, no, we're not going to do that. You know what I mean? That's not one of the strategies. We are who we are. And I think, standing firm in that is important. And I love what you said, because we said, we're not afraid, right, to take the risk of being out here doing the work. So whatever we need to do, and we've made our even small shifts, but in the chat area, for all of you that are on that work for various organizations, whether it's the school or whether you're in education, higher education, or the high school. I know Dr. Moon is at Tempe Union. My son's at Tempe Union, so we adore Dr. Moon. But put in the chat area, what strategies are you all doing? What are you seeing? What are you hearing? What are some of the strategies that you all are doing? And Erick, I would love to bring you in to just share, what are some of the strategies that you all are doing? Because really right now, what we're seeing a lot of resistance and pushback against DEI efforts in the cities, larger organizations, in the school system, right? Anybody that has sort of federal ties or funding in some way. So what strategies can organizations, and individuals use now to maintain that resilience and continue making progress?
Yeah, I would say listening and adapting without compromising your core values. So you kind of mentioned this when regarding the name change with DLA. but it's really acknowledging the concerns and then creating a space for dialogue that allows us to clarify misconceptions and really stay confirm on our commitments. So I say this in the sense of kind of Kamana mentioned this earlier, really framing DEI as business imperative. If you place it in that and look through it through that lens, you're able to make sure it's integrated in everything that an organization is doing. It's built into your mission, your vision, your values. But when you have it set in that space, it becomes a steadfast kind of a North Star that you're looking at, and it becomes a space that you're not going to change your values. So an organization, kind of taking DEI out of that, you wouldn't change your values because you need to shift what your organization is doing. So if DEI is integrated into those values and that mission and that vision, you're not going to be changing the work that's happening just because the landscape shifts just a little bit. So the idea really is being able to listen and adapt without changing those values. And I know it's hard. Many times we get put in this place of fear, or we don't know what's going to happen, or a lot of uncertainty. But really being able to keep that as our North Star. But then also, I would say within that, encouraging storytelling. So this is, many organizations do this, but I would say now more than ever, I would say storytelling is truly important and a space that we can find impact from. It's really it allows us to create connections and allows us to foster this deeper understanding of each other. So we're not just looking at the data, we're not just looking at kind of what's on paper, but we're getting to feel what people are saying or what people are experiencing. It really reminds me of that Maya Angelou quotes. I think I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. I always go back to that when I think about storytelling, because that's what you think of when it comes to storytelling. You remember how they made you feel, what that experience and what mindset they put you in. So I would say those two areas would be really critical, that are relatively a newer space for an organization to think of, that's outside of kind of the key areas that they've been focusing on. But staying steadfast to your values, but then also encouraging storytelling from staff.
Absolutely. And I want to kind of shift a little bit because I want to get to Sheila's sentiment, which is what I'm hearing a lot of. So Sheila posts in the chat area that their organization has completely eliminated DEI initiatives, right, for their office. And so the thought is like, not sure what to do from here. Like, how do we go from here? Kamana, what do you think? What happens when, as an organization, you still believe in the work, you still embody, the sentiments of it, you still believe in it aligned to business practice, but what happens when DEI is eliminated from your office?
That is painful, and unfortunately we're seeing a lot of that right now, right, happening. But there are also organizations that are doubling down, and we're seeing that as well. So I am so sorry that Sheila is going through this, but in reality, I think DEI is not going anywhere. I don't think it can. I don't think we can afford to let DEI go anywhere, right? But how we as individuals, how organizations, how we frame it, how we implement it, and how we sustain it, be it part of HR, be it part of our operations, that's where we need to evolve, right? So if we want to keep making the progress in this face of resistance right now, we have to shift from DEI as an initiative. And that's unfortunately where a lot of us and a lot of organizations are. It's an initiative. That's why these ERGs, these IND councils, they are like not paid positions. They are volunteer, and they are presented in a way where, as a person of color, if I don't participate in it on top of my full-time job, it's a loss for me, right? So it's an extra burden. So I think we really need to shift into DEI as an operating principle. So again, I mean, I also want to kind of talk about reframing DEI as workforce performance and business resilience, right? So for example, I work in telecom, and if companies in telecom, companies that design with diverse users in mind, whether through accessible technology or culturally relevant marketing, they win bigger market shares. So maybe let's connect to our marketing professionals, talk about the added value DEI can bring, and offer that lens, right? If you talk about healthcare, I've worked in healthcare as well, actually all my life. Culturally competent teams, they improve patient outcomes, which directly impacts hospitals' ratings and revenue. Let's talk about that, right? So I really think we really need to like frame it differently, and also focus on everyday equity, not just big initiatives. Like Dr. White said, we should not be, because we'll be exhausting ourselves if we focus on just the big initiatives, right? So DI, it doesn't have to mean we're launching this huge program. So for instance, in healthcare, simple changes like, adding interpreters to patient interactions or adjusting shift schedules, it can dramatically improve employee retention and patient care. So I think the key here is quiet, consistent actions over loud statements. That's where my headspace is. And instead of announcing DEI as initiative, we should just build equity into how things get done. And it might not be called DEI, it might be something different.
Yes, and it's so interesting you say that. Dr. Moon also says that in his chat comment. He says, "Don't get caught up on the acronym, right? Like, don't get caught up on the acronym. Focus on the actual meaning and actions behind the phrase, rather than getting overly fixated on the acronym itself." It's so interesting. So I will tell you just a quick story. Is I was at a panel, right, of all women, and this woman was very adamant that DEI is the reason that in education, we're not, she's going on, right? She's going on about that. And I said, I would love for you to do something for me. Okay. She's like, I don't support DEI. I said, okay, instead of saying the acronym, say each of the words and repeat what you said. So the statement actually is, I don't support diversity. I don't support equity, which means women, right, being equitably paid, right, bridging that pay gap. And I don't support inclusion. When you say it all word by word, and she was like, well, that's not what I mean. I said, well, that's what DEI means. So when you're saying it, right, what are you really saying? I think we have to have a cognitive understanding of what we're saying. We're saying, I want this to be a homogenous environment with everybody that thinks like me, that acts like me, that all the things, right? And I don't want to include others. I don't want it to be equitable. So if someone's getting paid more than me, then I don't want that. And then she said, well, when you put it like that, then it sounds weird. And I said, does it? Yeah, because that's actually what you're saying. So anyway, so Doctor, I thought it was so interesting. And I wasn't trying to stump her, but I think, we get caught in these acronyms, right? But we don't really know what we're actually saying. And I said, and that inclusion part is, I don't want to include people with disabilities. I don't want them to have access. I don't want, that's because that's essentially what you're saying. And it really shifted. She said, I have to rethink this. That was the last thing she said, Dr. White. I have to rethink this. And I said, please do. I invite folks to really just kind of think about it. So Dr. White, I'd love to bring you in and just kind of hear what your thoughts on this.
Thank you. I wanted to chime in on this very explicit question because it's one that I have engaged in many conversations. And I love the idea of a great reframe, because I believe that the acronym DEI certainly has been weaponized because there's a lot of misinformation out there that people are holding on to. And we have to help correct where people are misinterpreting what diversity, equity, and inclusion truly are. And to your point, Joanna, there's so much power in saying those words independently, because collectively, yes, it has a certain, misconceptions about it. But when we say the words separately, I think that it carries a lot of power that makes it more difficult for someone to really refute that. And in essence, is conscious leadership. It, in essence, is making sure that everyone has full opportunity for success. I mean, we know the different ways to be able to talk about it, but I think that how I'm relating this to Sheila's question in the chat regarding what do you do when it completely goes away? Part of what comes up for me is that I think this is a reckoning moment of us as individuals really getting clearly aligned with our values and seeing and determining if those values are also aligned with the spaces and places that we find ourselves in. Now, I'm also keenly aware that we have to put food on the table. We have to take care of ourselves. And so sometimes those decisions can be really weighty and it may take some time. But I do think that that's an exercise that all of us should be going through at this time. The other thing that I'm finding is with all of the announcements that are being made by so many brands who are reducing or getting rid of their DEI work, I really want us to pay attention to the fine print. Because what I am seeing is that a lot of those organizations, while the work may look different and perhaps it has changed and been reimagined, many of them are not getting rid of it altogether. And so I just don't want us to jump at the assumption and conclusion that when we see media bring up a particular brand to say that they're now moving away from DEI, that we don't take the further necessary steps to understand exactly what the fine print is saying. Because I think that media right now is really gravitating us to a message of the doom and gloom. And I don't want that to be what we're holding our hats on, because I think there's so many other organizations that are doubling down, or they are being very proactive in trying to understand what shifts can we make right now to help us sustain the impactful work that we've already started. So I just thought that was important to bring to the conversation.
Yes, powerful. Yes, thank you so much. I see Kim Covington. I see you have your hand up. I didn't know if you had a question. I would love to be able to allow you. Kim is over at Arizona Community Foundation, has been a partner with DLA for many, many years. So Kim, if you wanted to, I would love to allow you to talk. I know your hand has been raised. Um, I'll allow you to talk if you had a question. Kim, did you want to ask a question to the group? I'll pause for just a second. She may have hit that by accident. So, okay. No, I'll come back to you, Kim. If you have a question, drop me a note in there. I want to make sure we're getting your questions answered, because if you're anything like me, you'll get to the end and go, oh, I forgot that question because I didn't write it down. So, Erick, I want to go to you now and just talk a little bit about staying kind of in the realm of resilience and sustaining this momentum. What do you think in terms of metrics? I mean, how are organizations and communities, even individuals, what are they going to use to measure progress when we talk about cultivating resilience, right? Building more community. What does that metric and measurement look like? Or even sustaining allyship? What does that look like?
Yeah, I would say when it comes to metrics, it's using what you have available. I know it might look a little different now, and in certain states and places, data might be a little limited at this time. But just kind of speaking from what I'm used to and what I'm accustomed to is that the data that you have, you might, from an HR standpoint, you will have your HR workforce data. So you'll be able to see what the landscape of your organization looks like, whether it's one group is underrepresented or one group is more represented. You'll be able to see when you look at gender identity. You'll also be able to look at places such as potentially disability and veteran status. So not just looking at one area in particular, but really getting the lay of the landscape of what your organization looks like. So typically that data set and those metrics are readily available. When you look at the next step, most organizations do provide surveys, kind of a all staff survey that allows you to get a pulse on whether individuals feel like they're included in conversation, whether they feel like they belong. I know that they're very robust usually and huge, but there's oftentimes, if your organization does allow to have some questions that give you a response of how people feel and how their sense of belonging is being within the organization. I think I would say that is another place to look at. If most of the staff does not share that they feel like they belong within the organization, you can also maybe take it a step further and say, okay, who are these individuals? Are these underrepresented individuals, by kind of cross-referencing the two, if the system allows for that? So I know that's in the perfect world where you have the perfect HR system or the HR software to be able to connect the two, but I think being able to see what the landscape looks like and see kind of why people might have some, whether it's concern with DEI at your organization or whether people feel that they're not having growth within the organization. Because you can also look at succession planning. Is that available for staff? You can look at development opportunities and who they're available to. You can even look at things such as awards. Who's receiving awards across your organization, and are individuals who are underrepresented, are they receiving those awards, or is it just the same person over and over again? So keeping all of that top of mind when you're looking at how to approach this lens and really, like, I'll say it again, but what your landscape looks like at the organization.
Absolutely. So, Kamana, as we think about this, I would love to go to you to ask the question about allyship. I like co-conspiracy a little better. That feels a little active, right? Allyship is kind of passive. Like you're standing on the sideline going, go, Joanna, go, Joanna. Co-conspiracy is you're in the street with me going, let's go, Joanna, right? So let's do this. So thinking about allyship and co-conspiracy, I get this question a lot for those that are not in marginalized communities, for those that are not people of color. You know, when we look at allyship and we look at co-conspiracy, in terms of support, right? Building deep, sustainable allyship and co-conspiracy relationships and supporting marginalized communities. What should people be doing now? What can folks be doing now within their organizations, within their community, even as individuals? Because I get this question a lot, right? Joanna, what can I do? You know, what should I do? What, you know, how should I be responding, reacting? So what are your thoughts on that? And Dr. White, we'll go to you next. I would love to hear your thoughts on that. Kamana, please.
You know, Joanna, I'm at a point where I'm like thinking we need to really like center and reframe and redefine, not that the work um that we did before, you know, let us here, right? It's important work, it's really great work, but allyship, I think that's another area, right? We think we need to redefine allyship and redefine it as less about helping, because that's what it's always been, right? You're helping the LGBTQ community, you're helping you know, the minorities, the people of color, and it should be more about investing, because that's what it is. You're really, if you're my ally, I am from Nepal. I was born and raised in Nepal. English is not my first language. I moved to the United States as an international student. If you are being my ally, I don't want you to feel pity on me and be my ally and help me. I really want you to be invested, right, in my growth. So if you really think about allyship from that lens, I think that's where we need to go. We need to change the language, because the language we use around DEI, around allyship, how we frame it, it really matters. So when we talk about allyship, people often talk about it's the act of generosity, right? Like you're being generous, you're helping, you're helping because you care, right? That's what we see most. But when we shift the conversation to investment, what it does, it makes it about shared success. Now we're sharing the success. So if I'm investing in equity, because when marginalized communities thrive, we all thrive, right? When there was a ramp built for our disability community, we all benefit from it, right? So that's where I think it's a game changer thinking.
Yes, that's powerful. Thank you. Dr. White, please, if you would share on this question.
Well, I'll start by saying I love Kamana's reframe of investing in others. I think that's such a great way to talk about this broad work of being a co-conspirator or an ally, or even I've heard the word accomplice. There's so many ways in which we've talked about this essence of standing in solidarity in someone through direct action. And what I want to point out is that it's not just any action, you know, because we all can do a lot of things, but we have to ask ourselves, is this action useful? And is it useful to us, or is it useful to the individuals in which we're trying to be an ally and an advocate for? And so sometimes we skip that very important step of adding clarity around that very important question. And if we really are true allies and we are standing in solidarity through useful action, we have to know that that action is useful because we have to be in community with the individual or the population of people in which we're really trying to advocate for. And that looks like work, because it is work, but it's work worth working for. It causes us to have to get into the trenches, to get our hands dirty, to get on our hands and knees, right? And to really be directly impacted and affected by the effort we're putting in order for us to realize and manifest what we're seeking as an outcome. And so to me, I often say that we need to be willing to take risk, right? And taking risks sometimes can look like sacrificing ourselves, whether that could be our social capital, our, you know, whatever kind of capital that we may have that allows us to be able to use that to influence opportunities for others. Are we willing to do that? A great example of recent that actually has been at the forefront has been Rachel Maddow. We know that MSNBN has released a number of their minority journalists and professionals, and one in particular is Joy Reid of The Readout. And Rachel Maddow, she said at the end of her show this week, she expressed her thoughts, and that was incredibly risky for her to do that, but it was her moment of showing up. And my understanding is that there was definitely direct risk to her, and there hasn't been any direct repercussions for her, but they have then made some shifts to her team as a result. And so, she brings in a lot of revenue. Let's be honest with, recognizing that sometimes decisions are made based upon the outcomes that organizations are able to see to the bottom line. But my point is that she knew, I'm sure, going into that, this is going to be a risk and there's probably going to be some implications. But I feel so strongly about this that I am willing to sacrifice that on behalf of someone that she felt deeply she needed to be in solidarity with. And so it is about taking that risk and useful action by co-creating the outcomes and the efforts in order to be able to really meet the need of those in which we're standing in solidarity with. And last point that I'll bring up is that we have to be aware of our own sources of power and privilege in order for us to be effective allies, accomplices, or co-conspirators. So this is not about us shying away from where we have power and influence and privilege. Sometimes I think that we think about it only in the negative context, but all of us probably, if we were to take inventory of our lives, we have opportunities that will position us through our privilege of being able to have capital that can be used for others that we are standing in solidarity with. And so it's about acknowledging the power and privilege and using it honorably to help someone else along the way.
Oh, that's so powerful. You should see this chat going off. I want to read this quote that was put in here by Dr. Moon. And Dr. Moon, I would love if you could tell me who this quote is. I think I've heard it before. If you have come here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together. Yes, yes, yes. I am taking that. I am posting that today. That is so powerful. Dr. Moon, would you tell me, do any of you know who that quote is by? I don't know who the quote is by. If you would just tell me in the chat, I would love to be able to share that out and give credit to who the quote is. It may just be Dr. Moon. That may be who we're citing. So, but I wanna just move quickly, and thank you all for the chat. Thank you all for the comments. We have a couple of questions in the Q&A area we'll get to in just a little bit, but I want to just keep rethinking and reimagining, right, our DEI strategies. So as we're thinking about this, right, how our company, because a lot of leaders are conflicted right now. They've got half of their population saying, oh, good, we don't get to do this DEI stuff anymore. I'm so glad we're not doing these trainings, right? And you've got the other half that are saying we still need to be steadfast, focused, continue to do the work. So that's happening in many corporate cultures, lots of business communities around the country. So as we think about this, how are we going to make and keep inclusion, belonging, equity as a priority during these challenging times, when they're getting pulled from, especially if you're in we have some board members that are in utilities, the utility community, when they've got corporate, utility, but they've also got farmers, they've got folks that have farmland or, so they have those two polar opposites. So when we're thinking about this, Erick, I'll start with you. Right, we're thinking about that question. What does that look like? What does that look like in terms of rethinking and reimagining inclusion, keeping it as a priority, especially in these challenging times? What do you say? How do you move? What's that navigation look like?
Yeah, I would start off with if it is under a space where there's thought of it being removed or changed or taken away, I think start off with what previous impact has been. I mentioned this a little earlier, is being able to share what previous impact has been, how staff has felt, how they're moving forward, how they're engaged, being able to pull all of this information together to tell that story. And ultimately, I would say that would lead to a space where you're protecting DEI budgets and resources. I mean, it starts from there, because if you have your employee resource groups, many of them probably do have a budget or a little bit of funds they can use to help sustain themselves. So it does serve as kind of a snowball effect there, but I would say start off with being able to bring in that impact that you've had, tell that story, of course, the business case. We're always having to circle back to that business case, especially now, but starting with that, moving into protecting those budgets, because like I said, ultimately it snowballs into other spaces like your ERGs and even DEI councils that might need to have some funds to continue to grow. But then also looking at spaces where you're continuing to integrate this into the work that's happening. So of course, integrating it into leadership accountability. So what does that look like when it comes to whether it's inclusive leadership practices for your middle managers or senior leaders? How are they being inclusive of staff? Also looking at talent strategies. So how staff is being recruited, how they're being retained. Are those policies and procedures equitable? Are they something where you're not excluding a certain group of people? And I say this because we move into a space now where AI is getting integrated a lot into the work that's happening. And as organizations begin to purchase different programs or different software for some of their HR technology, that could be a space where if somebody isn't in the room to catch some exclusion that's happening in those processes, then ultimately that's getting built into your system. So I think it's kind of a twofold approach there, being mindful of what impact there is that you can bring to the table, but also being able to share just some of those, the importance of that funding so you can continue these processes.
Absolutely. So, Kamana, thinking about this and kind of staying on that same vein of questioning about rethinking and reimagining, how do you think, like, what are some of the innovative approaches? You know, Dr. White talked about strategic patience, right? Innovation and creativity being embedded into our work. So, what are some of those innovative approaches do you think that could be successful as we start to reimagine, right, the strategies that we're using? Things that go beyond just training, things that go beyond workshops and things like that. So, what does some of that look like?
I think for me, like the number one thing that we need to get out of the mindset of, how we have been focusing on fixing people. Let's fix our leaders, let's fix our executives, let's, instead of fixing people, let's focus on fixing systems, right? So that's where I think the real deal is. So right now, embedding companies that approach DEI, like digital transformation, for instance, like the company that I'm working for right now, we're focusing in digital transformation. It's been years we're focusing on that, right? So really think about that, the same approach, integrating it into decision making, see lasting impact, right? So that's where you see the lasting impact. So instead of relying on just training alone, be it your unconscious bias training, your inclusive leadership training, or whatever, instead of relying on training alone, I think companies should really start applying inclusive design thinking, right? So create better products, create better services, because the truth is the services you're creating for your demographics, it's always changing. Even if you're in small towns, small cities, your demographic is changing. We're being diverse. And like your workplace experiences is being diverse, right? And again, I really want to stress on, we really need to think about fixing systems and not just fixing people. So those bias training, they are not going to move the needle if your hiring practices, if your promotion, if your leadership pipeline is not reinforcing that, right? So organizations that implement structured interviews, for instance, or skill-based assessments or sponsorship programs, they see stronger diversity and leadership levels because they're fixing the process and they're not just raising awareness, right? They're doing something about it. And we also need to move from performative to participatory. I know we kind of briefly touched on this, but that's where DEI fails. DEI fails when it feels like an extra task on people. And the shift really needs to happen. And the shift is make inclusion part of everyday decision and team dynamics, right? So again, don't feel sorry for me. Don't come to help me. I don't want you to rescue me, but co-create with me. Co-create the solutions with me. Rethink your hiring practices with me, redesign your meetings with me in mind, right? And improve product accessibility because I am also using your product. So let's rethink that with me in mind, right? And lastly, like really redefining accountability over awareness, because in the past few years, what we've been doing with D&I is like really creating that awareness, right? Educating people, but we really need to start holding people accountable. So the best DEI work happens when leaders are measured on inclusion and not just educated about it. because the time to educate is way past that. We need to now hold them accountable. So when your executive compensation is tied to how inclusive you are, then we're talking, right? So and then like diversity will stop as an HR initiative and it will really become a business priority, because now what you're getting is directly tied to how inclusive you are. So really, I mean, to sum it up, the future of DEI isn't in more training, it's in designing inclusion into the DNA of how we operate, how we function. When inclusion becomes a natural part of business strategy, it stops being a program, and that's where it really truly starts driving real impact.
Wonderful. Thank you. So, Dr. White, as you think about the work that you're doing with your clients, and I'm sure they're coming to you now going, how are we innovating in this space, right? Like, tell us all the things. As you think of innovation, and as you said, creativity, and encouraging them to respond and not react, in this moment, in this time that is continuing, what are some of the approaches that you are reimagining for them that go beyond just training and workshops?
Yeah, I think this is a really important question. It's something that I have instituted, and I am even more aggressive with presenting this as a way of operating for organizations, is building in a storytelling culture. Now, storytelling has so much power, and storytelling in and of itself is not new to us. We share personal narratives all the time. But what I am not seeing is this very concerted and intentional effort for organizations to create within their culture storytelling as a way of operating, right? How in which we make decisions, how in which we go to market to be able to talk about some of the things that we do, the product or service offerings, all the things. And I think that storytelling is something that can help foster greater depth in terms of diversity, equity, and inclusion, because it brings out a level of vulnerability that allows the humanity aspect to show forth and be centered. It allows us to deepen our empathy and our compassion. It can bridge the divide of difference, because through our stories, we're listening to those feel words, and those feel words will connect us to that person and cause us to really want to support and have that level of care and concern. And so if you think about everything that I just described, I did not use words like diversity, equity, and inclusion. I talked about storytelling and what storytelling can do. And the output of storytelling produces a lot of the attributes and upskilling that we want to see people have when they are engaged in an organization that really values diversity, equity, and inclusion. And so I think that's something that's critically important. The other thing that I am really interested in seeing organizations get smarter about is, how do we talk about the work of DEI from a standpoint of opportunity versus obligation? Now, this is already happening in some capacity, but I think that there's still work to be done for us to catapult that language and those conversations to the next level. When we think about DEI from a standpoint of obligation, we tend to ask questions like, well, what can we do to help DEI out? How can we help poor little old DEI out, right? Instead of, if we think about it from an opportunity perspective, then we're asking questions like, what can DEI and committing to DEI do for us as an organization in terms of our productivity, greater level of collaboration, being an employer brand of choice, building our reputation with our consumer base and other stakeholders. And so sometimes just that paradigm shift can be really critical and important. And I think that this, particularly now, the juncture that we're in now, makes it imperative that we start to reimagine how in which we're talking about DEI and the work of it. As I mentioned before, it's nothing more than just conscious leadership. We can't separate that. So if someone says, I really want to get rid of DEI, are you talking about conscious leadership? Or are you talking about having people in your organization to feel a sense of belonging, which is about being seen, valued, heard, and saved? If people are always questioning whether or not they belong in an environment, they are not bringing their A game. If they're questioning, do I belong here? Am I seen? Am I valued? Am I heard? Do I have full opportunity for success? Does my opinion matter? Am I safe? if they're questioning those things, then they are really not showing up at their best. And when we think about that at the individual level and the organizational level, it should spark us to want to go deeper into reimagining and being very innovative to figure out how do we allow people to have that strong sense of safety and belonging so that as a team, as a department, as a unit, as an organization, as a society, we can all show up at our best and be at our best.
Ah, that's so wonderful. I have to tell you, I'm on about 5 pages of notes. I don't know about you all in the workshop, but they have taken me to school right now, so I am just a writing fool over here, which I love. And that is the other thing I want to just stress to everyone is this idea of being a lifelong learner. I mean, we do this work. We're DEI practitioners. We do this work, but I'm always learning, and that's part of the educator in me. I teach at the university, and even styles for how we approach people. But that whole thing of being seen and heard. I'll tell you a story about. I have international students that are in my class. Some are from China, some are from Japan. And what's hilarious is they always tell me their American name that they've adopted to make it easier for professors to pronounce their name. Well, you know this, they come up with, and they'll say, "Oh, my name is Jill," and I'm like, "Is your name really Jill?" "Well, no, my name is." And so I will go beyond. I mean, I go beyond to make sure I can pronounce their name. And let me tell you, when I call on them by their birth given name, they are stunned. I had a student come up just last week and said, "I have been at the university for 3 years. Not a single professor has ever taken the time to see me and then move me beyond to see me and take the time to learn my name, and say it correctly." And even when I got it wrong, I said, "Okay, say it again. I want to make sure the inflection is correct." That is how we honor people. And I think we forget that in those small things is how we can really, show up for people and make sure they are seen, they're heard, they're valued. And I think that's the thing when we think about DEI that we're not doing enough of. We sit idly by and go, "Well, it's not affecting me, so I'm gonna sit quiet over here." And but what's that quote? "They came for me in the night. Best be sure they might come for you in the morning." So we need to be careful about how we're aligning with and supporting with individuals within our organizations. So Eric, I want to go to you because I know that you do a lot of training. I know you guys do a lot there at Mayo Clinic. Are you seeing some shifts? How are you seeing in terms of programming? Are you all still doing training and workshops, or what's that innovation and creativity looking like from the Mayo Clinic perspective?
Yeah, so I would say when it comes to training, it's shifted to be a space of experiential learning. So we've talked a lot about storytelling. We've talked about a lot about sharing experiences and impact, but a lot of the education now comes in the form of this experiential learning, but also focusing on cultural humility and identity. So as we
Mm,
look at what that looks like for all of us, I mean, you can think of your own personal identity. I think for myself, as you probably heard of my bio, my partner, I have 2 kids. I have my job that I think is important to me. Those are some of the top things that I have. And then you get into my race. So I'm Hispanic, Mexican. So that makes up my own personal identity. So when I talk about that in the workplace, it's really ensuring that our staff feels that they can bring their authentic selves to work. I know we've all probably heard that term over the past 10 plus years when it comes to DEI, but it truly is a space. You will not feel that you're belong to the organization if you can't bring your authentic self to work. And that is your identity. Your identity is what makes up who you are. So a lot of the education really relies on that space of allowing people to see that they are included in the space, and even individuals who might feel that they're not diverse. So it brings them into this equation as well, because identity isn't just when you think of race or culture, it's all of those things that encompass that larger space. So that's the approaches that I've typically taken more as of recent of getting people to share their stories, and others can kind of learn from those stories and grow from those, opposed to the more formalized education where we're talking about bias and microaggressions and so on. But getting individuals to understand what others go through on a day-to-day basis, almost a walk in someone else's shoes approach.
Absolutely. And it's so interesting you say that. So, from a creative approach, I was having a tough time with my students in the classroom at Arizona State, where they were not like connecting with each other because they saw each other in this very monolithic way, right? Oh, that person's a, this and they're that. So we did a I am intersection as our introduction, an intersectionality exercise. And all they had to do was list all of the things that they were. So it started with, I am female, I am a coach, I am a daughter, I am a sister, I am an older sister, but I'm also a younger sister. I mean, they went through the whole, and what was really interesting, this group of people that thought they had nothing in common, right? They're all like, well, that's a frat boy. I don't, I have a sibling with a disability, right? So I am an advocate. They went through this whole, and the aha moments they had across the room was so profound. Like, me too. Yeah, I have a sibling that, I have a younger brother. I have an older sister. I coach also. Where do you coach? Where do you? And so I stopped him for a second. I said, interesting. When we started the class, he was like, well, that's, those are the frat boys over there. I don't really hang with them. They don't know, or our students of color, they don't know anything about me, and it was so brilliant to talk through intersections. And that is one activity. It's such a simple activity, to talk about the intersections that we all have, and I even started with me. So when I share with them, so Kamana, very similar to you, I say, I am an immigrant. I am African. I am Russian. And that always throws them off, like, say what now? Which is brilliant. So then they have to ask. And that's the other thing it did. It forces you to connect with another human being and really ask the question about, did you say you were Russian? Yes, I did say that, and you go through, I go through all of my intersections, and it allows them to humanize me, right? So I'm not just professor, right? I'm also a mother. I'm also a daughter. I'm also a friend. I'm an advocate. I'm a caregiver. All the things that make us, and then it humanizes it. And I think that's the point that we are missing. That's why I love the idea, Dr. White, you talked about storytelling, really kind of aligning ourselves to people's stories. Oftentimes in a cultural environment like a corporate workplace, we don't get to do that. I do trainings with people that have worked together for 10 plus years, and they didn't know someone had a kid. They didn't know that this person was going through, their parent was not doing well or in hospice. They didn't know all the things because that's not fostered, right? So when we talk about innovation and creativity in terms of the workplace, I think we have to give people more connection points, and not see it as disruptive to the work, and not see it as, we shouldn't talk about personal stuff at work. I don't want to know your stuff. It's not that, but then you can see me through a lens that you may not be able to see me. I'm not just Joanna from HR or whatever, or, so that you can really humanize. I think that's the piece that's missing. So as we move forward, I would love to ask Dr. White, I'll have you kick us off on this one. But so as we're thinking about looking ahead, what are you seeing emerging in terms of trends or maybe shifts in trends, right? And for those that are on today, how can we help them redefine how organizations can build stronger, more connected communities, especially over the next 4 years? And then I saw in the chat, if you would also tell us a little bit more about your book and some of your work and how people can connect, that would be amazing.
Absolutely. So let me start with saying I just placed a link into the chat to my most recent book, which is actually my book baby. It's 2 years old, actually, the end of January, but it's called Inclusion Uncomplicated: A Transformative Guide to Simplify DEI, and that's in partnership with Forbes Books as my publisher. And I would love for this community to see it as a resource. I think that, as I mentioned earlier, there's a lot of misinformation out there about DEI. And the more that we can help uncomplicate it and to get people who are kind of on the sidelines or just have their heels dug in tightly to say, I don't want to even engage because I don't want to say the wrong thing or have someone to counsel me. I think that part of us being able to bring people along is recognizing that part of the resistance sometimes is the fear and the feeling that this work is so daunting and complicated. And so I want to try to unpack that for people, and that's what I do through this source. And so that is available to you. So I want to go back to your question about maybe some of the trends that I'm seeing. Well, the first thing is that we know that we are in a highly technological boom right now, where AI is really creating some additional complexities and opportunities that many organizations are going to have to think intently about in terms of how do they integrate the use of AI technologies into their workplaces. And so I'm seeing a lot of organizations trying to get ahead of that so that they can use it ethically, but also at the same time allow it to be something that fuels the organizations in terms of greater, efficiencies and productivity. But in order to do that, we have to care deeply about the concerns that AI can create if we aren't leveraging those tools and they aren't being developed with the mindset and a lens of equity and inclusion. And many of them are not, because right now, a lot of people are of the persuasion is better for me to just be focused on speed and get to market, and then I can work out all the kinks later. So I just want to, give a heads up that that is not necessarily the most ethical way to do it and to avoid harm that can be created as a result of it. So that's one thing. The other thing that I'm seeing in terms of a trend is that we've talked a lot today about the importance of community right now, right? And I think that that is also top of mind for many organizations. And what I'm seeing is that similarly to employee resource groups, business resource groups, affinity groups, there is this deepened commitment and interest in creating these communities, right? And they're doing it in a way that takes into account the intersectional lens that many of those individuals within the workplace are showing up with. It's no longer just about one particular population based upon race or ethnicity, but it is now, how are we aligning our employees around experiences that are common, that is not just singular in nature. And I think that's important because right now we are seeing that people are craving community. People want to be connected with others that they feel like they have a sense of safety with, and that there's some alignment around values. And that is helping people to get through the workday. Some of you may have seen a lot of articles about, do you have a workplace bestie? If not, you should get one. And here's why. It's kind of a similar sentiment. Having someone that you really can connect with can make the workplace experience, especially if you're in a workplace that is challenged right now in terms of how it's showing up for its marginalized employees from a DEI perspective. So those are the two things that I'm seeing, most commonly. I also will say that there are a number of organizations who are having to reimagine some of their initiatives that are very tailored and structured for very specific communities or populations because of what they're seeing within the executive orders. What I want to say is that I know this community is representative of so many different professionals that are a part of a variety of organizations, whether you're private sector, whether you're education, whether you're nonprofit. But I want everyone to be mindful that what we are hearing and seeing right now in terms of a lot of the executive orders, they are not law necessarily. They are not legislation. And that is important to amplify, because a lot of organizations, of course, whether they're in the private sector or not, they're kind of taking their cues and they're being influenced by what's happening. And that's leading to a lot of shifts and changes in programs that are already working well. And so let's not abandon the foundation of things that are working well. There may be a time that we're going to have to reimagine, shift, and change and modify. But right now, let's just not assume that we need to throw the baby out with the bathwater, right? I think that we can, again, practice that strategic patience and make sure that we are clear where we need to make the shifts, and not just getting rid of programs or initiatives and other policies and procedures that really are in place to help us fuel the work of diversity, equity, and inclusion forward.
Absolutely. Oh, brilliant. Thank you so much. Such wonderful nuggets in the chat. Everyone's saying, Rosalind just said, so hello, Rosalind. Yes, yes, and yes. So looking ahead, so then Erick, I'll go to you. What are you seeing in terms of emerging trends or shifts in DEI, and what do you foresee? How are we going to redefine, right, how we do our work and connect our communities, especially over the next 4 years? What does that look like for you?
Yeah, I would say adding on to a little bit of what Dr. White said regarding community-centered DEI strategies, I think that is where a larger space where we are heading. I think more organizations will collaborate with external communities, really looking at smaller local businesses. They'll look at nonprofits and educational institutions. And in turn, that really helps with talent pathways and economic growth in many of those spaces. I do see a lot of cross-sector partnerships. So specifically within healthcare, education, social services and so on, there's going to be a lot of cross collaboration, because I think we're realizing now that healthcare isn't just standalone, your social sector isn't just standalone. There's a lot of integration that can happen between the two. And I think it's one of those spaces where we're stronger as a larger community. So as we start to expand, I think we see that approach. And then, of course, speaking from healthcare, from my lens, I think in healthcare, there's a lot of focus, especially now and into the future, on social determinants of health, economic mobility, and health equity. So ensuring we have healthy communities, continuing to utilize things such as our community health needs assessment to drive the work that's happening, but also gauge, okay, our community might not be as healthy as it can be. So what things can we do, or who can we reach out to and help utilize those connections? So I really believe in one space. I mean, there's multiple that are upcoming, a lot of converging trends that are taking place, but I would say the community centered approach is what will be, I think, key over the next 4 years or so.
Excellent. Thank you so much. Kamana, we will end with you. As you're looking ahead from your lens, your perspective, and the seats that you sit in, what do you see? What do you foresee in terms of what will help us redefine how we build stronger, more connected communities?
I think Dr. White and Erick covered it all very beautifully, but what I would like to add here is, I see both challenges and opportunity ahead, right? So DEI right now, the state we are in, we're in a moment of turbulence where DEI is being questioned, it's being diluted, and like Sheila shared, even dismantled, right? So, but if history has shown us anything, it's that, most transformative progress is born out of disruption, right? So let's remember that. Most transformative progress is born out of disruption, right? So let's not lose our hope. And Joanna, this concept of oneness of community that DLA has brought, it's so timely, and it has never been more critical. Because at its core, it's about recognizing that our fates are intertwined, that equity, inclusion, and belonging are not just initiatives, right? But they are very foundation of thriving workplaces, of thriving communities, of thriving societies. So while some of us may see division right now, I see a growing urgency for deeper connection. So this is definitely, organizations like DLA, it's definitely helping us connect with each other and be a stronger community. So in the next 4 years, I believe we'll see a shift from performative DEI to embedded people first cultures, right? So like I talked about earlier, where inclusion is not just a department, but it's a shared responsibility. It's woven into leadership behavior, it's woven into decision-making and everyday interaction. And companies that truly commit to this shift will not only sustain DEI, but will future-proof their workplaces for the next generation of talent. Because what is your next generation of employees coming to you? The first question employees are asking is, what's the culture like, right? So that's the most question that employers get. So at the same time, I don't want us to ignore the present chaos. We are in backlash. The backlash against DEI is real. And the fatigue among us DEI professionals and marginalized groups, it's real. It's daunting. But here's the thing. Resistance does not mean retreat, right? It means reimagining. And that's what we'll be doing. We need to reimagine this. So instead of being discouraged, we must double down on what works. We must create cultures of belonging that are undeniable in their value, right? So like I talked about, like, how would you reframe, psychological safety helps, blah, 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 reframe how you say things, right? So I often think about how movements don't die, they evolve. And DEI is evolving. So we are evolving. And what gives us hope is that we're doing it together. So when organizations and communities choose courage over comfort, they choose allyship over optics, and action over avoidance, we will see the next era of DEI emerge. And that era will be one that is sustainable, collective, and deeply human. So the work has never meant to be carried alone. This DEI work is not meant to be done alone. It's always been and always will be about all of us together.
Wow. Like and listen, I was about to snap, right? Right. That was beautiful. Thank you so much. I have to tell you, I am so grateful to each and every one of you. You had different perspectives, but lots of, as someone said in the chat area, lots of very valuable nuggets, that you can walk away with, that you can think, okay, I can reframe it this way. I can, put some energy behind it in a different manner. I can approach it from this way. Okay, they're eliminating it, but I can still do this work. We did have one question in the chat area, not the chat area, the Q&A area, from Dr. Moon, and I wanted to make sure. So if you all could, I won't read the whole front part, but the question is actually around your thoughts about how best to foster and promote. We talked about this a little bit. Merit and DEI as complementary concepts if strategically approached within the organization. So any thoughts, Dr. White, as you read this question in the Q&A area? Kamana, Erick, any thoughts on Dr. Moon's question, especially about the pushback? So what about merit-based hiring as opposed to DEI initiatives? Any thought on that?
Well, I'll just lead in by saying, again, I think this is one of those areas where there's a lot of misinformation out there, because if we really look at the stats and the data, we see that a lot of the communities of professionals that are in, part of marginalized populations are the ones who are, maybe more further educated. They have deeper experience and deeper qualifications. And there's so many examples that we can point to with some of the recent shifts in employees throughout even the federal government. And so I think that we have to be willing to refute misinformation and correct it when it comes out, and not be afraid of that. I mean, facts are facts, data is data, and data can be really powerful in helping to create greater parity when the conversation, requires for it. So that's what I would say.
Excellent. Anything to add, Kamana or Erick, as we wrap up and address Dr. Moon's question?
Nothing for me, actually. I think Dr. White actually covered it perfectly. Thank you.
Excellent. Excellent. Kamana, you, anything to add to Dr. Moon's question?
Yeah, I think Dr. White perfectly summarized it.
Excellent. Good. Well, I am so grateful to each and every one of you. So we have Kamana Khadka joining us from Cable One. We have Erick Garcia joining us, of course, from Mayo Clinic, and Dr. Nika White. So my fangirl, Tonda's laughing at me, just so you know, in the background. She knows that as soon as she introduced you to me, I'm like, okay, I'm officially a fan. So from Dr. Nika White from Nika White Consulting, thank you so much to all of you for your time, for your expertise, for being so vulnerable and open and sharing, everything with this group. And I think they're going to walk away with some really wonderful little nuggets that they can then implement. And as we said, the words may change, but the fight continues. As we move forward, I want to, Kamana, you mentioned this oneness of community topic. I want to thank Tandra Richardson, who is co-chair with Erick on this committee, on the education committee. The lovely, I can't say your name without saying the lovely Tandra Richardson lost her voice. So yeah, I know. So I said, we got you. So she's on. I just wanted to recognize her and thank her for her time and her expertise, and for leading, along with Erick, this tremendous effort to really ensure that we have innovative, timely conversations that really are designed to impart change. The work we do here at DLA in the community would not be possible without the important contributions from all of our volunteers, our sponsors, and our board of director members. You heard from him earlier. I just wanted to make sure I give him another very special thank you, which is Mr. Marion Kelly of Mayo Clinic, the founder of DLA, for his continued guidance, for his leadership, and just moving the needle forward on social justice for 20 plus years. Also, I wanted to note on here that board members Tandra Richardson and Mr. Greg Troutman from City of Phoenix are on as well. Thank you for your continued support and for joining us for today's session. And last but certainly not least, we have these great, amazing graphics that you all see that make us look so polished, right? So Maria Radloff of Via Maria is on as well. Maria does all of our graphic design. And I think that is why I love being in community with these individuals. Maria and I talked yesterday, and we just shared similar sentiments of that's how we affect change. And I'm telling you right now, that is going to be my new favorite quote, right? That Dr. White said, joy is a form of resistance. That was a moment for me. So thank you for that. I love the idea of remaining joyful and not fearful and not anxious and not, uncertain, just remaining in joy. And I think joy and connection with each other and with our communities is going to be imperative. So we would not be able to do any of the work that we do here without our amazing sponsors that help underwrite our program. So thank you to Mayo Clinic. Thank you to SRP. APS is also a sponsor, Cox Communication. They're the ones that continue to support DLA and all of the programming that we do year round. So we are very grateful to them. We're grateful to all of you. We don't for one instance take your time. It is a commodity we do not have enough of, right? So as we move through the rest of our week, as you move into the weekend, do so with a little bit of joy in your heart. And hopefully with a little bit of more energy, and know that you are part of the solution because you are part of the community. So before we sign off, Dr. White, Erick, Kamana, any last words for these communities before we bid them adieu? Any last words to share? Dr. White?
Thank you for the opportunity to be here. Thank you for sharing into the chat. Just keep doing what you're doing. Maintain that sense of hope because we will get through this. We will get through this. It's going to be okay.
Yes.
Yeah, thank you, Joanna and DLA, for this really timely conversation. And I love being in this community. Today it might seem uncertain, right? It's difficult, but believe me, tomorrow is ours. And we are in community and we're standing for each other. So more power to us.
I love that. Tomorrow is ours. Yes, Erick.
Yes, I thank you so much, everybody, for your chats and just hearing the uplifting words. I want to just leave you with this, kind of as Marion said from that book. We're off to great places. I know it's a tough time right now. We're in the waiting place, but I think we'll get there. As you said, history has been tough, but we've got through it. So we just have to look a little different. So thank you all, and just continue what you're doing. Thank you.
Absolutely. Thank you to all of you. I wish you a great rest of your day. Most importantly, be good to yourself and be good to each other. Cheers. You all take care now. Bye-bye.